In our morning checkup here today, Dr. Fahd Rawra is joining us to talk about quit smoking. And it seems to be it's the buzzwords, I think, for several years. But of course, you see the commercials on the dangers of smoking. So good morning to you.
Good morning.
It's a topic that, to be frank, you chose here this morning. And so I'm guessing it's pretty important. And it's something that you wanted to talk about. Why is that? Why is this on your list of things that people need to know about?
I think it's just generally there's a lot of people smoking. And we're more aware now of all these issues that you can get from smoking. It's not something that can only kill you, but also cause a lot of other medical issues that can make your life very difficult, like, you know, heart disease. It can cause erectile dysfunction. It can cause issues with your lungs. So day to day, you know, even breathing normally as you're walking, it really limits you. People won't be able to do simple things like go for a jog and things like that. So I just think people don't realize that there's morbidity, is what we call it. Your day-to-day functioning can also be affected, not just cancer and the big illnesses as well.
Right, little things that maybe you take for granted could be taken away from you.
Absolutely.
What about quitting then? What are some of the best ways for people to quit?
Okay, so first and foremost, it's not easy to quit because it's not supposed to be. Most people that do end up quitting, they quit after trying several times. So this is for everybody out there. You know, don't get discouraged if you try once and are not successful. Go back at it. Try to do it again. It is simpler, or I should say, easier now to quit compared to maybe several years ago. We have some medications that people can get that help you quit, and obviously nicotine replacement products. There's been a lot of studies, and they keep doing all these studies that show that the combination of the medications along with the nicotine replacement products really helps, increases your chances of quitting.
If the nicotine replacement's giving that nicotine, what's the medication part of it? What does that do for somebody?
You're talking about the actual nicotine replacement?
Yeah.
They actually it has nicotine in it.
Okay.
So, yes.
But then if you're on the other side of it, though, the medication part, if you said one of the treatments you can combine the two, right? What's the medication then? What does that do?
The medications are bupropion, which is an antidepressant, and something called Chantix. The bupropion actually increases some levels of dopamine in your brain, which is a reward chemical.
Which is what you kind of get
from smoking, yes.
Okay. And that replaces that kind of,
right? That gives you that kind of sense of, I'm doing okay.
Because when people are quitting something like smoking, they're missing something when they're not smoking.
Yes.
Right?
And that's, I mean, I want to talk about some tips. And one of the things I always tell people is, you know, try to picture and remember the time when you were not smoking. You know, people are always like, oh, well, I will not be able to function. I've been doing this for years. But everybody, there was a time when you were not smoking.
Right.
Try to really picture that and think about that and be like, hey, you know what? I was functioning when I wasn't smoking.
Right.
So why can I not do that when I do quit?
All right, good tips, and it's just darn expensive as well. I mean, if you look
right,
at the prices.
And plus, you have to go outside and it's very freezing cold.
All right, thank you much for coming in. We'll be back here in a couple of moments.
Thank you.